Okay, hi, it's Dr. Buford. We're just getting started on the right knee. We're looking in the medial compartment first. This is where we were concerned about the MRI scan. This is the anterior horn of the medial meniscus. It looks great. We can lift up on it. It looks like it's solidly attached all the way around. We get into the body of the meniscus where there was a little bit of concern about tearing. And while we keep our scope pointing medially here, we can look at the meniscocapsular junction. It looks good. I'm going to leave my probe there and rotate around. That gives me a look around the side here. And so I wonder if that wasn't read as maybe a little bit of a tear right here, right where my probe is, but that looks like it's solidly attached. And we're going to inject that area with PRP in a minute. So when we look under the meniscus, and we can hook it and pull on it, it's very stable. So I do not see anything that rises to the level of needing to be repaired. We'll look towards the posterior horn back here, and other than this inner edge fraying, which is pretty common as we work and play hard, I don't see any significant tearing back here either. Push down on the knee, please. Great. And so we can see all the way around to the root. A root tear would be way back here at the tip of the probe. The root tears need to be repaired. We can hook that, make sure you don't have a hidden root tear. You don't. And then this is the posterior horn of the medial meniscus, and other than some inner edge fraying, it looks pretty good. And so we'll take a little bit of a basket forceps and trim out the inner edge, but we really don't have to take away any significant meniscus. Okay, so this is your anterior cruciate ligament here, and it looks pretty good. That couldn't look better. The posterior cruciate ligament's just to the right behind this little fat pad, but the ACL looks good. We're going to look in the lateral compartment next. Okay, so now we're looking in the lateral compartment. There's some really small little loose pieces of cartilage, probably coming from this tibial plateau. You can see how this is a little bit scuffed up. The femoral condyle up above looks like it's in better shape, but the plateau is not so much. Just a sign of early arthritis, another reason why we're doing the PRP injection. You can see how it's a little bit soft. I don't see anything else grossly loose. As far as the meniscus goes, this posterior horn looks great. So this is, you see that? So this is posterior horn of the lateral meniscus. Behind the meniscus there, that's the popliteus tendon. The popliteus runs up in your right knee. It runs up towards about 11 o'clock on the screen. I'm touching it right there behind the meniscus. There's an area right in front of the popliteus where the meniscus is not attached to anything. That's called the popliteal hiatus. That shows up on test questions sometimes, but that's a normal thing. Back here, the meniscus looks like, let me take a probe. It looks like it's okay. We're just going to probe it just to make sure. So we can see a little split maybe there, although my probe really won't go down into it. So that's a superficial split right there. And again, I don't think we need to repair that. And then here we can see the rest of the meniscus is well attached. Let me just turn on a little bit of suction, and now we'll go ahead and take a little bit of a pair of scissors basically and trim up the edge, and we'll be done here. Okay, so now we're looking at the patella at the top of the screen. And a little bit of chondrosis here, not too bad. There's nothing really loose. I'm touching it with the shaver, and it feels pretty stable, but you can certainly see where it's not as smooth anymore. The trochlea down below still looks like it's in pretty good shape. We can track it all the way down the front of the knee there, all the way down to where the ACL goes back in the notch. So the trochlear cartilage looks pretty good. So I think we're done with this part. We're going to go back and I'll show you the lateral compartment here if I can do that easily for you. So you can see the lateral compartment now looks pretty good. It's the tibial plateau that has a little bit of fraying on it. Okay, and so I think we're done. We luckily, fortunately, didn't have to do a meniscus repair. And now we'll go ahead and drain the knee and at the very end do our PRP injection. So I really hope this does the trick for you. Good luck to you now. Bye-bye.